Hi, my name is Kyle Doyle. Today I'll be doing exterior setups of the femur and the hip. So the femur will be done at a cassette, 14 by 17 cassette, and an SID of 40. So first we'll do the AP for the distal femur. So the patient can be standing or supine. The bottom of the cassette should be 2 inches below the knee joint, and then our leg should be internally rotated about 5 degrees. Our central ray is going to be perpendicular to the film, directed straight through the center of the film, and collimation will include the femur and the knee joint. Then for the proximal femur, the top of the cassette is going to be 2 inches above the greater trochanter. So right there. Our hip is going to be internally rotated 15 degrees this time, and our central ray will again be directed perpendicular to the film, right through the center of the film. And collimation will include the femur and the proximal femur and the hip joint. Our lateral femur, the cassette is going to be, the bottom of the cassette will be 2 inches below the knee joint again. The patient will be standing to the side with their lateral leg against the cassette. Here's my side marker here. So their lateral leg will be against the cassette, and legs will be in a staggered stance so that there's no superposition of the other leg. And so the hip will be slightly flexed like this. The central ray will be directed perpendicular to the center of the film, directly through the femur. And collimation will include the distal femur and the knee. We will not get any hip in this view because you would have superposition of the pelvis. Now we're going to move on to hip views. These will be done on a 12 by 10. I'm still going to use this piece here because it's the only one I can hold up against the wall. So our A to P hip. So patient can be standing or supine. Leg will be internally rotated 15 to 20 degrees. Our central ray will be directed perpendicular to the cassette, and it'll be pointed at the height of the greater trochanter, about 1.5 inches medial to the ASIS, so about right here. And our collimation will include the ilium, the acetabulum, the femoral head and neck, the greater trochanter, the pubic symphysis, as well as the proximal portion of the femoral shaft. Our lateral hip can be done on a number of different ones, different views, but I'm going to demonstrate the frog leg view. So the patient's hip will be flexed and abduct, and the knee will be flexed also, so that the bottom of the foot is facing internally and resting against the leg. Our central ray will be directed perpendicular to the film, directly between the ASIS and the pubic symphysis, about 1.5 inches inferior of the ASIS, so about right through there. And collimation of this will give us a view of the pelvis, the femoral neck, the lesser trochanter, as well as the acetabulum. And then lastly, we're going to have the pelvic outlet view, so the patient can be standing or supine again. For this one, the central ray will be directed, for males, it'll be directed 20 to 35 degrees cephalad. For females, it'll be directed 30 to 45 degrees cephalad, and will be directed 2 inches below the pubic symphysis or the greater trochanter is about the same height. So we directed that direction, facing up. Collimation will give us a view of the pubic and ischial bones. It'll give us a symmetric view of the obturator foramens as well as the hip joints. And those hip views will also be at an SID of 40. And for these, if appropriate, we will have shielding over the patient's stomach and chest.